Ever feel like some medical treatments are stuck? Like way behind where they could be?
Well,
Today we're going to dig into one of those.
okay,
A therapy that's scientifically fascinating, but for some reason, still kind of controversial.
let's hear it. Which one are we talking?
Hyperbaric oxygen therapy. You familiar with that?
HBOT, yeah, I've heard of it. Isn't that like pure oxygen in a pressurized chamber?
That's it.
Yeah.
But there's way more to it than people realize.
Okay, so what are we diving into? Some new research paper.
A book, actually,
Yeah.
called Oxygenation Is The Solution.
Mhm.
And it's not just about the science. It gets into the legal battles and the ethical stuff that's kept HBOT kind of underground, you know.
Interesting. So who wrote this book? Sounds like they're in the thick of it.
It's written by this solicitor, Brian Lynch. He handles medical negligence cases.
Oh, wow. So he's seen both sides, the patients who are struggling and the legal system.
Exactly. And get this, he actually credits HBOT with his own recovery.
Right.
After this awful horse riding accident.
No kidding. What happened?
He was thrown off the horse, ended up with some really bad injuries. Docs were saying months in a wheelchair.
Ouch. Yeah, that's serious. So how did HBOT come in?
He started HBOT, and he says it was the key to recovering way faster than predicted. Like, cut his recovery time in half.
Wow, that's incredible.
7 weeks instead of 13. I mean, ditching the wheelchair early and getting off painkillers sooner, huge difference.
Absolutely. So this personal experience, that's what got him so deep into the legal and ethical side of HBOT.
Yeah, it fueled this whole deep dive for him. He starts with this basic question, right? If we know oxygen is crucial for healing.
Which it is. Every cell in our body needs it to function.
Right, so why not give our bodies a massive oxygen boost when they're injured or struggling?
Makes sense. That's essentially what HBOT is, right? Giving your system that extra oxygen it needs to heal faster and more effectively.
Exactly. Okay, before I read this, I'll admit, I picture those chambers like something out of Star Trek or something.
Yeah, they can seem a little sci-fi. I get it.
But the science behind it is actually pretty basic.
Yeah, it's not rocket science, pun intended. Basically, breathing pure oxygen in a pressurized chamber allows your blood to absorb way more oxygen than it normally could.
So it's not just about the oxygen you breathe in, it's about how much your blood can actually carry to your tissues, to those injured areas that need it most.
Exactly. It's like supercharging your body's natural healing process. And, many health problems, whether it's an injury, an infection, even aging, are made worse when cells don't get enough oxygen. They're struggling to function, let alone repair themselves.
It's like that oxygen debt idea he talks about, right? Like,
Yeah.
our cells are literally starved for air.
Yeah. And HBOT directly addresses that by flooding your system with oxygen. It's like giving your body the resources it needs to kickstart its own healing mechanisms. And honestly, we experience this on a smaller scale all the time.
Really? How so?
Think about how you feel on a high-pressure day. Clear skies, you feel more energized, right?
Yeah, actually I do.
That's your body subtly reacting to the increased atmospheric pressure, which means you're absorbing a bit more oxygen.
Oh, interesting.
HBOT takes that natural effect and, well, amplifies it, but safely, of course.
Yeah, the book actually debunks that myth that hyperbaric means some crazy intense pressure, like we're diving to the Mariana Trench.
Right. It's a controlled environment, and our bodies are more adaptable to these pressure changes than people think. Like when we fly or climb a mountain, we're experiencing pressure shifts already.
Okay, that makes sense. But then why isn't HBOT more common? It seems like if it's based on these natural principles, it would be a go-to therapy for so many things.
Well, that's where the legal stuff comes in and where things get really interesting.
It's kind of frustrating, right? We hear these stories about groundbreaking treatments, but then they get stuck in this weird limbo for years.
Oh, absolutely. And meanwhile, people are out there struggling, maybe not even knowing there could be another way.
Exactly. So is that what's happening with HBOT? Is that why it's not more widespread?
That's what Lynch really digs into, yeah. And he brings up these legal cases that are super relevant. It all comes down to informed consent, or rather, the lack of it.
Informed consent. Okay, so like making sure patients understand the risks and benefits before they agree to something.
Yeah, but it's even bigger than that. See, for a long time, medicine was really paternalistic, Doctors decided what was best, and patients just kind of went along with it.
Kind of like doctor knows best, right? We're the patients, we just do what we're told.
Exactly. But things are shifting. Cases like this one, Montgomery versus Lanarkshire Health Board, it was in the UK back in 2015, that really changed the game on informed consent.
What happened in that case?
The court basically said, nope, Doctors can't just tell patients what they think is the best course of action. They have to tell them about all the reasonable options out there.
Even if the doctor personally doesn't like that treatment, or it's not what they'd usually recommend.
Yeah, even then. Because it's not about the doctor's preference, it's about the patient being able to make an informed choice. And that means knowing all the possibilities, right?
So even if a doctor thinks HBOT is a little out there, if it's a viable option, they got to tell the patient about it.
Exactly. And for HBOT, that's huge because patients might not even know to ask Hay about it if their doctor's acting like it doesn't exist.
It's like that saying, you don't know what you don't know.
100%. And this isn't just a UK thing either. Lynch talks about another case, this one from Ireland, the Dunn case. And in that one, the courts actually went against common medical practice.
Wow, really? Why? What was going on there?
Yeah, it all boiled down to informed consent. The court basically said that clinging to old standards of care, that's not a good enough reason to withhold info about a treatment that could help.
So these legal battles, they're really pushing the medical field to evolve, huh?
They're definitely shaking things up. And for patients, that's a good thing because it puts more power in their hands.
This whole discussion's got me thinking about COVID. Was there talk about using HBOT for that? I feel like I remember hearing something.
Oh, yeah, definitely. There was a lot of back and forth about it, especially early on. Lynch talks about how some doctors in China and the U.S. were trying HBOT with COVID patients, and there were some promising results.
Makes sense, right?
Uh,
Since HBOT is all about boosting oxygen, and COVID can cause those serious breathing problems.
right. HBOT is known to be effective for hypoxia and inflammation, both of which were big problems with severe COVID. But there wasn't time to do those big randomized trials that doctors usually rely on.
Because everything was happening so fast with the pandemic.
Exactly. So you had this situation where some doctors were hesitant to try HBOT or even tell their patients about it because they were like, we don't have enough hard evidence yet.
But then at the same time, people were really sick, and here was this treatment that potentially could have helped.
That's the dilemma, right? And it gets to this huge ethical question that Lynch asks in a pandemic. When things are that urgent, is it right to deny a treatment just because we're waiting for perfect proof?
Man, talk about a tough call. How do you even begin to answer that?
Seriously. It's like this impossible choice. But thankfully, there were some folks willing to try. Lynch tells this fascinating story about Opelousas, Louisiana. They actually used a hyperbaric chamber meant for scuba divers to treat COVID patients.
Oh, wait, are you serious? A scuba diving chamber?
No, seriously. And apparently, some of those patients had really quick improvements. It just shows you how, in an emergency, you got to be open to thinking outside the box. And those unconventional solutions, sometimes they work.
That scuba diving chamber thing.
Yeah.
Wild, right. It
Mhm.
really makes you think, like, what other uses are out there for HBOT? Maybe we're just scratching the surface.
Totally. And the book goes there. Lynch talks about all these other conditions that on the surface seem totally unrelated to COVID or diving accidents, but HBOT might be helpful for them too.
Yeah. Like brain injuries, stroke recovery, even fibromyalgia. He even gets into using it to slow down aging. It's a lot to take in, I'll be honest.
It does seem like a stretch, right? Going from treating the bends to like chronic fatigue. But what Lynch does so well is he brings it all back to the core mechanisms of HBOT.
So it's not about chasing specific diseases. It's more about treating those underlying problems that a lot of conditions share.
Exactly. Think about it. Tissue damage, inflammation, cells not getting enough oxygen. Those are factors in a ton of health problems.
Okay, that makes sense. So even if it's a brain injury from way back or something like fibromyalgia, if the root issue is those cells needing more oxygen, HBOT could be the key.
That's the idea. And he backs it up with examples from his own practice, real patient stories. Like there's this one about a rugby player. He was dealing with a concussion.
Oh, yeah, I remember that one. Didn't he let them track his brain scans throughout the whole HBOT treatment?
He did. And the impairments they saw were undeniable. Seeing those brain scans change, it's like, wow, this is actually healing on a deep level.
That's got to be powerful, not just for the patient, but for the doctors too, right? Like proof that it's working.
Totally. And that's what I love about this book. It's not just about saying HBOT is the answer to everything. It's about giving patients the knowledge to ask questions, to advocate for themselves, to be open to all the possibilities.
It's like he's saying, don't just accept things the way they are. If you're dealing with something, anything, do your research, ask those tough questions, and demand to be informed.
Exactly. And that's how informed consent becomes real, you know? It's not just checking boxes. It's about that doctor-patient partnership. Open communication, talking about all the options, even the ones that seem kind of out there.
So as we wrap up this deep dive into HBOT and oxygenation is the solution, what do we want our listeners to take away from all this? What do we hope they'll do with this info?
Honestly, I think the biggest thing is to stay curious about healthcare, about everything. Don't be afraid to ask those what if questions. What if our bodies can heal in ways we haven't even discovered yet? What if there are treatments out there that could be game changers?
It's about getting back to that place of wonder, not just accepting the status quo, but digging deeper, especially when it comes to something as important as our health.
Yeah. Couldn't have said it better myself. Sometimes, like what Lynch did with HBOT, that's how the real breakthroughs happen. Somebody looks at something in a new way, asks the right questions, and boom, everything changes.
Love it. Well, that about wraps up this deep dive. Hopefully this episode's got you thinking, got you fired up to be your own health advocate. Keep asking questions, keep exploring, and we'll see you next time for another deep dive.